With health news, many of the people injured in the Asiana plane crash suffered traumatic injuries. For more on the treatment of those injuries, we're joined by our CBS 47 medical expert, Dr. Giatri Dave. Dr. Dave, hi.
Good afternoon, Sarah and Jenny.
Okay, so you hear traumatic injuries. Well, to us who don't have a medical background, we think anything remotely severe is traumatic, but there's a special classification for that.
That's right, Sarah. Traumatic injuries occur when there's a sudden blow or jolt to the body, such as after a motor vehicle accident, a fall, or a crash. In the case of this plane crash, there's a sudden change in velocity from a high speed to a stop, which can result in the body being jerked back and forth across the seatbelt or possibly hitting a seat in front of you. And this can result in injuries to the brain, the spinal column, the long bones of the arms and the legs, and internal organs.
Okay, so out at the airport, the emergency responders were praised for triaging the patients correctly. What exactly is triaging? You hear it at the ER, but other than that, we don't really know.
That's right, Jenny. When there are a large number of people that are injured, it's important for the emergency responders to quickly identify the most severely injured that need immediate care and comprehensive care. For example, at a surgical trauma center, a high-level trauma center, studies have shown that people that are critically injured have a lower likelihood of dying if they're taken to a level 1 trauma center, such as San Francisco General Hospital, where a majority of these severely injured people were taken. And you don't want to have all the less severely injured people taken to this type of a trauma center, because then it'll take resources away from the people that really need them.
Fortunately, because the plane was in the process of landing, everybody was in their seat, strapped in. But still, why so many spinal injuries?
Well, the spinal column is vulnerable because it's a long column that has many parts, including the spinal cord and nerves, which are surrounded and protected by the spinal bones and the ligaments. And when there's a sudden force to the ligaments, they can tear and the bones can fracture or break. And these damaged parts can in turn injure the spinal cord or the nerves, which can result in pain, weakness, or a loss of function in the legs or arms or organs.
So would a shoulder belt like they have in a car, would that have helped versus just the lap belt you have in airplanes?
We know that the shoulder belts, or the three-point belts that form a V across the shoulder and the lap, are more protective in cars to secure the chest and the pelvis. But what's not clear is in an airplane which is traveling at a much higher speed, if these more protective belts would just transfer the injuries up to the head and the neck area, which would not be secure in an airplane.
All right, thank you, Dr. Dave. And still, your chances of something happening to you on a plane much smaller than if you're just walk across the street or drive.
That's right, a very low likelihood.
All right, Dr. Dave, thank you so much for your time. Dr. Dave joins us every Tuesday here on CBS 47 at noon. If you have a question or topic idea for her, just email us, newsdesk@cbs47.tv.
Still to come.